Shuklam Varadaram Vishnum Shashivarunam Chaturbhujam Prasannavadanam Dhyayed Sarva Vignopashantaye Guru Brahma Guru Vishnu Guru Devo Maheshwaraha Guru Sakshat Param Brahma Tasmai Shri Gurave Namaha Om Kanchi Vasaya Vidmahe Shantarupaya Dhimahi Tanno Chandrasekharendra Prachodayad. Namaste. Welcome you all for the day 2 of 5-day workshop on theory and practice of pranayama. Today we shall look at 3 important techniques. In that, one of the most effective, very useful, safe technique called abdominal breathing. Then we will also look at chest breathing and complete breathing. The theoretical aspects, what the clinical research says about these techniques, in particular abdominal breathing, slow breathing, and why we should practice that, and the practice protocol. So as usual, we will begin with simple warming up postures. Lie your back, fold both the legs, stretch both arms up, neck at the center, chin towards the chest. Be aware of your breathing. Press both the feet, heels closer to the hips. Now raise your right leg up. Stretch the toes, pull the kneecap. Press the left foot, tighten the back of the left thigh. Fold down. Left leg up. Pull the kneecap, stretch the toes. Ensure that the sacrum, that is the portion of the spinal column, that also rests on the mat or floor. Down. One more time, right leg up. Pull the kneecap, stretch the toes. Feel the stretch in the back of the thigh and the calf muscle. Breathe with awareness. Down. Left leg up. Fold down. Next one, right leg up, fold, hold the knee, press the knee closer to the chest, stretch the toes, tighten the back of both the thighs. This is very good for the gluteal muscles and the lower back. Release. Right leg. Left leg up. hold the knee, press the knee closer to the chest. Watch your breathing. So all these postures are good for the core muscles. They help you to sit comfortably for the practice of pranayama. Release. Left leg. One more time, right leg up. Hold the knee. It is highly recommended that these postures are done before any of these practices with the sitting posture. Release right leg and then change. Left leg up, hold the knee, press the knee closer to the chest. Release left leg. Next one is right leg up. Fold Padmasana. Stretch the toes, push the knee. Feel the base of the spine, the sacroiliac joint. Release right leg. Change. Left leg up. Fold Padmasana. Take the heel as close to the root of the right thigh as possible. Stretch the toes, push the knee, tighten the back of both the thighs. Release. Left leg. Right leg. Again. Push the knee. So these simple postures conditioned our musculoskeletal system for sitting comfortably. Release right leg and change. Left leg up. Fold Padmasana. Tighten the back of both the thighs. Release. Left leg. The next one is right leg up. Hold the ankle joint from left hand, pull it and press the knee across the chest. This is a very good stretch for the gluteal maximus muscle. It also helps the lower back. Down. Left leg up. Hold the ankle joint from right hand, pull it. Press the knee across the chest from the left hand. Stretch the left toes up. Release. Left leg. Then right leg up. Hold the ankle joint, pull it and press the knee across the chest. Be aware of your breathing. It is also good for the abdominal region and the lower back. Down. Then the left leg. Hold the ankle joint, pull it and press the knee across the chest. Now release left leg. Slowly get up. This whole process will take about 8 to 10 minutes, but very, very essential. And when you want to sit, it is good to sit on a couple of blankets or a pillow because This height differential will help you to sit upright. And we sit in the so-called Gnana Mudra, or the tip of the thumb and index finger in contact. Generally, that is the mudra we use. So sit upright, Swastikasana, Virasana, Vajrasana, whatever you are comfortable is okay. So now we shall, before looking into the practice, we should understand why we should do. What is this research in yoga says about these breathing techniques? In particular, breathing slowly. We generally breathe about 15 times per minute. If you reduce it to about 6 cycles per minute, it will do a lot of wonders. This has been reported in multiple research studies on yogic breathing. Simple, slow abdominal breathing. So we will look at some of the theoretical aspects as well before we go. You know that we have 3 cavities. The abdominal cavity, chest cavity, and the pelvic cavity. These are the 3 major cavities which we use for breathing. And chest cavity has lungs and heart, abdominal cavity has all digestive systems, and pelvic cavity has all the reproductory system. And attention to the diaphragm, which divides the thoracic cavity from the chest cavity. The diaphragm is a large muscular member that divides the abdominal cavity from the chest cavity. And then the movement of the diaphragm, you must observe. As in, for inhalation, what happens? The brain centers send a signal to the diaphragmatic muscles and the intercostal muscles, the rib cage muscles, and in particular the diaphragm contracts and moves down so that the lungs expand and air goes into the lungs, and the abdominal region also expands. Then as the diaphragm relaxes into the chest, it presses the lungs, air comes out. So this is the procedure, and this is very close to natural breathing, and it's very important that you do this. So the technique for abdominal breathing is the following. As you inhale, the bottom of the abdomen, which includes pelvis, then the middle, then the top of the abdomen should expand. As you exhale, it should contract. Chest should be as reasonably stable as possible. Very important, I repeat. As you inhale, the bottom of the abdomen, middle of the abdomen, top of the abdomen should expand. As you exhale, the abdominal cavity has to contract. When you inhale, the abdominal cavity expands. Then when you simply relax, the abdominal cavity contracts because diaphragm moves into the chest, lungs contract, air comes out. Then try to slightly contract the abdominal muscles little more than normal. That is what we are showing here. This dotted line is the movement. It moves little more than normal, and that's how exhalation happens. And in good abdominal breathing, the range of movement of the diaphragm. During inhalation, you see the dotted line here. During exhalation, the diaphragm moves further in. The range of the diaphragm also improves. So this itself has a lot of importance and a lot of good effects on our well-being. And here it is. Another view. Not only the front of the abdomen moves forward when you inhale, even in the posterior region, it is shown slightly exaggerated here, but there is expansion. Even sideways, there is expansion in the abdominal muscles. And what you see here is the pelvic diaphragm that also moves. You must observe all these things. During exhalation also you see the diaphragm moves further into the chest and abdominal region moves little more inside than normal. Even in the side view you see the same thing. So this enables us to breathe slowly. So slow inhalation, slow exhalation, that is important. What does this breathing do? When you do this, you must also ensure as you inhale, the abdominal cavity expands, then exhalation does not happen immediately. There is a small pause, then exhalation. After you exhale, there is a small pause, change over time, transition time. That also you should observe, then the exhalation begins. If you breathe like this, then what the study says, suppose you can breathe, let us say 4 seconds inhalation and 6 second exhalation, you will be able to do 6 breaths per minute. The studies, I am showing you the research paper. There are plenty of research papers. I have selected only few. What it says is this has positive effect on the autonomic changes and it increases what is known as heart rate variability and sinus arrhythmia and EEG studies also show that it is very, very positive and there is increased comfort, relaxation, pleasantness, vigor, and reduced symptoms of anxiety, depression, etc. People have studied on hypertension and they have found that this breathing, slow breathing, can reduce the hypertension. Then heart rate variability. This is a cardio-friendly breathing because it improves heart rate variability. You should understand that the heart, when it beats, there is a small change in the timing of from beat to beat. That change is called heart rate variability. It should, if it is very low, it is not a good heart. It should have some variation. That is a good heart condition. And research studies, these are all picked up from the research studies. It shows that this simple abdominal breathing, right now you can start doing. In fact, as you go through these slides, you can start doing this breathing. Then you see this study very clearly indicates that heart rate variability improves, and this is very, very good. And also it enhances positive mood and lowers the systolic blood pressure. Then it helps the circulation. As you know, the circulation here, the superior vena cava, which brings blood from lower extremities to the heart, that becomes more efficient. The so-called the collapsibility of the inferior vena cava, that inferior vena cava improves. So this is a very, very good thing for our circulation. Then people also many times experience, some of the people, this extra heartbeats. That's because of this preventricular contractions. There are studies which show that this simple abdominal breathing, 4 seconds inhalation, 6 second exhalation, that's all. Because when you inhale, the heart beats little more. When you exhale, it beats less. That is what is called as sinus arrhythmia. So that also improves. So it makes the heart to relax better, and this is the effect of this simple breathing. It also massages the internal organs, especially the abdominal organs, and that is why they've also found the study you are seeing there says that it can guard against GERD. GERD means gastroesophageal reflux disease. A lot of people suffer from what is called as acidity, etc. And there are studies which shows that this is a very good antidote for anxiety and depression. And there are studies which says that it is a great immunity booster. They have studied in comparison with treadmill, running on treadmill, and just doing abdominal breathing, they have found that the salivary immunoglobulin A, which is a very good indicator of our immunity, improves better in people who do abdominal breathing. Please start doing this. As you inhale, the abdominal cavity smoothly, gently expands. As you exhale, it contracts. Towards the end of the exhalation, contract the abdominal muscles a little more than normal so that exhalation becomes longer. Then it also nicely massages the back muscles and especially the thoracolumbar fascia, that is the thick skin on your lower back, also responds to the breathing. Please feel that, and then it also stimulates the chakras. We have energy centers, the lower three chakras, especially the Muladhara chakra, the Vishuddhi, and the Manipura chakra. They all get stimulated. They have impact on your endocrine systems and it helps to improve. Thus, this abdominal breathing, slow-paced abdominal breathing, is a Sampurna Swasthya Sutra. Very simple, very safe, suits all. So here is the procedure to do that. You have to sit upright. We have already said that, and then slowly inhale. You may close your eyes. As you inhale, the bottom of the abdomen, middle of the abdomen, top of the abdomen should expand in that order. As you exhale, the abdominal cavity has to contract. Chest should remain as neutral as possible. Air goes into the lungs only because lungs expand, but the expansion of the ribcage should be as minimal as possible. It's purely abdominal breathing. And try to ensure that you inhale for 4 seconds and exhale for 6 seconds, which is quite possible for everybody. So in practice protocol, what we have done is we have created a audio file, which I am going to play now. And this audio file has two sacred mantras, Om Namah Shivaya, Om Namo Bhagavate Vasudevaya. As you listen to Om Namah Shivaya, you should inhale. As you listen to Om Namo Bhagavate Vasudevaya, you should exhale. They are timed for 4 seconds inhalation, 6 seconds exhalation, including the pause of the transition. That is, when you inhale, there is a small pause before you exhale, and after exhalation, there is a small pause before inhalation. All that is taken care of in this audio file, and this mantra is a timer. And if you have belief, it is good to feel that deep faith in you so that you can do it with better attention. So this is about abdominal breathing. The practice starts now. Om Namah Shivaya. Om Namo Bhagavate Vasudevaya. 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 Om Namah Shivaya.
Bhagavate Vasudevaya. Om Namah Shivaya. Om Namo 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 Bhagavate Vasudevaya.
Good. Slowly open your eyes. The next breathing technique that we are going to look at is what is called as the chest breathing or the thoracic breathing. So here, as you inhale, the diagram very clearly shows, as we inhale, the bottom of the chest, middle of the chest and the top of the chest should expand. That is, it starts all the way from here, middle of the bottom of the chest, middle of the chest and top of the chest should expand, and as we exhale, the chest should contract. The abdominal cavity should be as stable as possible. There will be slight movement, but it should be as stable as possible. Slowly you have to inhale and the abdominal cavity should be stable. Only chest should expand. The bottom of the lungs, middle of the lungs, top of the lungs should expand in that order as we inhale, and you must feel every nook and corner of the lungs, from the bottom to the apex, which is felt near this collarbone or the bottom of the neck. You should inhale that way. Then simply relax. Because of the elasticity of the lungs, they contract, chest also contracts, air comes out. Okay, and then try to further contract the lungs little bit so that exhalation becomes longer. So this is called thoracic breathing. And initially, you can keep your right hand on the chest, left hand on the chest, right hand on the abdomen to ensure that you are breathing predominantly in the chest. Although most natural recommended breathing is abdominal breathing, doing chest breathing for some time has its own implications, and there is a study which shows, they call it a slow paced Bastrika pranayama, but it's simply this breathing which I have been telling you. And this breathing, 6 breaths per minute, 4 second inhalation, 6 second exhalation, can help to reduce the blood pressure. So this is the finding from this studies. They have made studies. So now we have to practice this. We are going to do this for about 5 minutes. Again, the same mantra, Om Namah Shivaya, Om Namo Bhagavate Vasudevaya will be played. As you listen to Om Namah Shivaya, you should inhale. As you listen to Om Namo Bhagavate Vasudevaya, you should exhale. You should exhale. So pay attention, do it with involvement. As you know, breathing is a process of divine, and we should respect it. And imagine as you inhale, as if the divine energy is going in, and as you exhale, all the impurities in us, physical, psychological, all these impurities are going away. That is the feel that you should have. We will start the session now. Listen to the sacred mantra, get involved, and practice with eyes closed.
Om Namah Shivaya. Om Namo Bhagavate Vasudevaya. 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 Om Namah Shivaya. Om Namo Bhagavate Vasudevaya.
Now slowly open your eyes. Well, now we will do what is called as complete breathing or Mahat Pranayama. Here it is a combination of what we did, the abdominal breathing and the chest breathing. What you do is, as you inhale, the bottom of the abdomen, middle of the abdomen, top of the abdomen, bottom of the chest, middle of the chest, top of the chest should expand in that order. You can see the line diagrams. As you exhale, first the chest should contract and then the abdominal cavity has to contract the same way as you did earlier. I repeat, as you inhale, the bottom of the abdomen, middle of the abdomen, top of the abdomen should expand. Then the bottom of the chest, middle of the chest, top of the chest till the clavicle should expand. Then simply relax, lungs contract, ribs contract, exhalation starts happening. Then the abdominal region has to contract. Then towards the end of the exhalation, contract the abdominal muscles actively little more so that exhalation happens fully. So with practice, you can go beyond 4 seconds inhalation, 6 seconds exhalation, but it is found from lot of studies that this 4 seconds inhalation, 6 second exhalation has lot of implications. Therefore, we again do this for about 5 minutes, complete breathing, 4 seconds inhalation, 6 second exhalation, and we use the same technique of the two sacred mantras which are timed for 4 seconds inhalation, 6 second exhalation. You may close your eyes and do the complete breathing.
Om Namah Shivaya. Om Namo Bhagavate Vasudevaya. 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 Om Namah Shivaya. Om Namo Bhagavate Vasudevaya.
Open your eyes. Well, this is about the abdominal chest and the complete breathing. So this is the basis. If this is all right, because in a lot of people, the abdominal breathing may be completely missing because that is the most natural breathing. What you should follow by default is abdominal breathing. And for many times, for many people, it will be reverse because they would not have even observed. So please observe, follow this simple, safest abdominal breathing. Anybody can do. There is no restriction and it does wonders. It is one of the greatest breathing technique contribution from the yogic studies and it has a very, very great positive effect on our well-being. It is also supported by a lot of clinical research. We shall offer our prayer to sage Patanjali. चित्तस्य पदेन वाचा मलं शरीरस्य च वैद्यकेन योपाकरोत्तं प्रवरं मुनीनां पतञ्जलिं प्राञ्जलिरानतोऽस्मि। हरिः ओम। श्री कृष्णार्पणमस्तु। श्री गुरुभ्यो नमः। शुभमस्तु।